my name's Hank. I'm a student physical therapist. We're going to do some palpating on Jacob today. Is that okay with you, Jacob? Yeah. All right, so we're going to start with the C2 spinous process. So I'm going to palpate the back of his head to find the external occipital protuberance. I'm going to drop off that, and the first kind of bony feeling that we get, that's going to be the C2 spinous process. That's going to be your atlas, so it's going to have your dens. It's going to allow you to rotate your head, make kind of that no motion with the skull. Yeah, and it's going to be the upper vertebra that we can feel because you can't palpate for the C1. Next, we're going to move to the C6, C7 spinous processes. That's going to be at the base of the cervical spine. It's going to be this bony protuberance right here. And the C7, if he puts his neck forward and back, it won't move. And the C6 will kind of disappear and come back. This is the attachment, the trapezius muscle and the rhomboids kind of attach up in this area, which is what makes that important. So using the traps, we'll come down to find his first bony landmark down in here, which is our first rib, anteriorly and superiorly to his clavicle, and we can feel it also down here. The first rib is a flat rib, and the importance there is like the subclavius muscle attaches from the clavicle to the first rib. What's next?
Articular pillars.
The articular pillars. All right, so we'll come back up to the spine. We'll find the spinous processes. We'll move out laterally. We'll find some bumps. The paraspinal muscles are going to run along these articular pillars and facets, and the facets are going to help kind of stabilize articulation of the spine up here. Yeah.
Spinal scapula.
Spinal scapula. All right, so we'll kind of come over here, the palm of our hand, find this most lateral thing, which is the acromion process, and kind of trace this back on the scapula. And that's going to be our scapular spine. So this is going to, the supraspinatus is going to sit on top of it, the infraspinatus will sit below, the traps will kind of come down and attach here, and then part of the deltoids come off as well.
AC joint.
All right, then we come forward back to this acromion process, and we're going to follow his clavicle from the front and kind of find where they're going to meet. They'll meet somewhere around about right there. The AC joint is important. It helps with the articulations of like the upper part of the shoulder girdle, so abduction and like shoulder movements, and it's commonly injured in like falling.
Subacromial space.
So coming from this acromion process, we're just going to drop down inferiorly and in the space below the acromion process and kind of above the head of this humerus, you're going to find the subacromial space. The supraspinatus is going to come through here. The tendon of the long head of the biceps will come through here. There's some bursa in that area as well, and it's a really common site of shoulder impingement.
Greater tuberosity.
Greater tuberosity, we're going to use the palm of our hand to kind of feel the most lateral bump on the upper part of his humerus here, which we've got located. It's going to be an insertion point for like a couple of the rotator muscles in the rotator cuff. So like the infraspinatus, the supraspinatus, and the teres minor. Yeah, and if you go a little bit medially, you're going to run into the bicipital groove, kind of where the long head of the biceps tendon is going to come up.
Coracoid process.
Coracoid process. We're going to come a little bit medially from the humerus, and we're going to drop down off this acromion process, and we're going to find a muscular bump ball. It's a little bit tender. This is an important, so it's a part of the scapula, coracoid process. So like the short head of the biceps tendon, the coracobrachialis, and the pec minor are all going to attach there.
Lateral and medial epicondyle.
All right, so to do this, we're going to find the shaft of his humerus, and we're going to find his supracondylar ridges and trace those down. We're going to locate the medial epicondyle right there, and the lateral one over here. Medial epicondyle is going to be the common insertion for all of the wrist flexors, and it's going to have your ulnar collateral ligament, and then your lateral epicondyle, it's going to have all of your wrist extensors, and it's going to have your radial collateral ligament. And then if you come into the cubital fossa here and kind of drop down off of that lateral epicondyle on the backside, you can find the radial head. And then if you have Jacob kind of pronate and supinate here, you can feel that moving. The annular ligament is going to help that articulate on the ulna for like the pronation and supination movements. And it's a common site of like the nursemaid's elbow in childhood where you can get a subluxation from being held over your head. So for the scaphoid, I'm going to have Jacob kind of extend his arm like this. We're going to come off of the radius into this anatomical snuff box, and if you feel in there, you're going to land right on the scaphoid bone. This is commonly injured in like a fall on your outstretched hand. So it's a common site of like wrist fractures. It's usually just the scaphoid bone, and a fracture there can impede your blood flow through your radial artery into your hand. Triquetrum, we're going to come to the other side of the hand here. We're going to find the shaft of the ulna and then the ulnar tuberosity. And we're going to fall in here, and we're going to be on the triquetrum. And then if we come this way, we'll find the pisiform. And if I have him radially deviate, the triquetrum will kind of pop out at you there. The importance here is that the pisiform kind of sits on top of it, and the triquetrum is one of the attachment points for the ulnar collateral ligament.
The joint line.
Knee joint line? All right. So to find this, we're going to find his patella here. We're going to palpate down to the apex of it. And then if you kind of go off that, you're going to be on your patellar tendon ligament area. If you go medially and laterally, you're going to find the joint space. And kind of right in here, you can feel that articulation between the femur and the tibia. This is important. It's a good landmark for a lot of structures. So if I have him bring his foot in, you can kind of palpate this medial meniscus. If he brings it out, you can palpate this lateral meniscus. If you come on the medial side and you kind of go to where your finger starts to pop out, that's where you're going to find like your MCL. And you can do the same thing over on this side, and sometimes bringing his leg in a little bit helps. And you can kind of feel a ropey structure over here on that joint line, and that's the LCL. To find the fibular head, you're going to come up here. You're going to locate his medial and lateral femoral epicondyles. You're going to drop off the lateral, and you're going to feel this ball-like structure right here below that joint line. That's going to be your fibular head. That's where your biceps femoris will attach, and your LCL is going to come in there as well. All right, so now we'll do the ASIS palpation. So I'm going to start with my palms kind of going to the flanks of the side here to feel for the bones. We're going to move to the front, and then we're going to switch to the finger pads, and we're going to find the bony end marks, and that's going to be the ASIS. That's important. That's where the sartorius attaches, and it's also going to be the attachment point of the inguinal ligament, which is going to go to the pubic tubercles, and that's going to be the lateral and the superior border of the femoral triangle, which will go fornix. So I'm going to have Kevin put his knee like this. Yep, and I'm going to have you adduct into my hand, and we're going to palpate for the adductor longus, which is about right there. We're going to fall into this femoral triangle. You can relax now. All right, and then we have the adductor longus medially, the sartorius out here laterally, and the inguinal ligament up there as well. And if you palpate in here, you should be able to feel the femoral pulse, because the femoral nerve, artery, vein, and then the lymphatic system in there. Liver. All right. So to find the liver, I'm going to come here and find his rib cage. We're going to find the base of it. I'm going to come a little bit, we're going to go underneath it and a little bit superior, and I'm going to have him take a deep breath. All right, perfect. We're going to come down here to that firm end feel, and that's going to be on the liver. And we palpate this. We're looking for like abnormalities like bumps, lumps, if it's puffy or tender, just to see if there's any issues there at the liver that we want to refer on.
Talus.
For the talus, we're going to come down here. Yeah, we're going to put Kevin into some plantar flexion. And we can feel for the lateral and medial malleolus and kind of work our way in on the joint line, and we're landing here on our talus bone. And that's important for articulations of the foot. It's going to be a main component of the talar curl joint, the subtalar joint, and our transverse tarsal joint, allowing all the different movements of the foot. And then for our navicular tuberosity, we're going to come over here to the medial malleolus, going to drop down inferiorly to find that sustentaculum tali, and we're going to come anterior to this first bony landmark here, which is going to be our navicular tuberosity. That's going to be an insertion point for the posterior tibialis, and it's also going to be the attachment of the spring ligament.
Base of the fifth.
All right, I'm going to use this foot for that one. So if we come out here to the lateral side of the foot and we kind of work down the outside of this fifth metatarsal, we're going to come to a big bump, and that's going to be our base of the fifth metatarsal. The fibularis brevis and tertius are going to insert around here. It's a common site of avulsion fractures, and if you come a little bit back, you can land on the cuboid.
ATFL ligament.
All right, so I'm going to put Kevin into a little bit of passive inversion and plantar flexion. We're going to feel around here for the lateral malleolus and the talus, and right in here, we're going to feel a ropey structure. That's going to be our ATFL ligament, and that's connects the fibula and the lateral malleolus to the talus, and it's commonly injured in our inversion ankle sprains.
Greater trochanter.
Greater choke. All right, I'm going to have Kevin lay on his side. All right, we're going to feel up around here. We're going to do a little bit of inversion and eversion. Well, internal, external rotation. Yep, and you can feel it right here. It's the kind of bony pop out, most lateral on the head of the femur here. And it's an attachment point for like the abductors of the hip and also the deep hip intrinsics for internal and external rotation.
Okay. PSIS.
All right, I'm going to have Kevin lay on his stomach here. Is it okay if I lift your shirt up a little bit?
Yep.
All right. So, same way we did that with the ASIS, I'm just going to kind of start out here at the sides, find a iliac crest, and we're going to slowly kind of work our way in until we find a similar kind of hard end feel right around here. Yep, and that's our PSIS. And that's going to be an insertion point for the posterior sacroiliac joint, and it's a nice landmark for finding like the posterior sacroiliac ligament. My bad. And then it's also a nice landmark for the sacrum because it's about on the same level as the S2 in here.
ILA.
ILA. All right, so coming in here off the PSIS, we're on the S2. We're going to kind of palpate down on this ischial tuberosity. Well, not the ischial tuberosity. I'm down the sacrum. And we're going to come out laterally, and we're going to find... Yep, right there. Where this is going to be where the sacrum starts to kind of take a dive down into the coccyx area, and it's an attachment point for the sacrococcygeal ligament.
Ischiotuberosity.
All right, so for that, I'm going to have Kevin kind of bring his leg up a little bit. We're going to find the gluteal fold, which is right about there. This is going to be the bone that you sit on. So if you come up from the gluteal folds with your palms, you should be able, yep, you can feel a bony end feel in here. And that's going to be where your hamstring muscles attach as well.
Okay. 12 rib.
12th rib. All right, we're going to kind of feel around above his iliac crest here in this open space. And we're going to find, yep, right about here, we're going to find his 12th rib, which is the floating rib. It's going to be the attachment point for like the latissimus dorsi, muscles like that of the back. And if we trace it up, we can find the T12 spinous process.
Okay. L5 spinous process.
All right, so to do that, we're going to find his PSIS again. We're going to come in, and we'll be on the S2. We're just going to work our way up and find that, the L5 spinous process. And this is going to be the largest lumbar vertebra. It's going to bear a lot of the weight of the body. And in between the L4 and the L5, you're going to have a lot of intervertebral disc dislocation issues.
Very good. Thank you, Hank.